Our job is to provide, in general terms, to provide advice to the government of Quebec about issues that impact on access to health and social services in English. And that's important because in health and social services, language is a service tool. You wouldn't expect a cardiologist to be able to listen to somebody's heart without a stethoscope, and you can't expect a clinician to do an evaluation if they're not able to communicate with the person that they're treating. The right of access to services in English is not an absolute right. It's a right that is conditioned on a certain number of things being met. Among them, that there is an access plan, and that access plan to English language services has to take into account the resources and the organization of services in each region. Ambulance service is perhaps the area where you have the highest possible need for there to be good communication. A person is in crisis, even if they speak French under normal circumstances. At that moment, they may or may not be able to communicate. Their family may or may not be able to communicate. And the ability to understand what's wrong is critically important for the first responders. And yet, not one single ambulance service is in an access plan. Now, that doesn't mean not that nobody can get service in English. Lots of ambulance attendants do. Lots of paramedics do speak English. And people do want to give good quality service, but there's no legal right to those services. That's something that we need to address. It was never the intent to bilingualize the entire health and social services system. That would be politically unacceptable and practically not reasonable. So the premise of the way this is set up is that if you go to your local institution and you want service in English, if they can provide it for you there, great. But if they can't, they need at a minimum to be able to refer you and explain to you how you can go about getting that service in English, either in another institution in your region, or if you're prepared to travel, at an institution in another region. Making all of that fit together is a complicated technical task, and it is at the heart of the work of the Provincial Committee. What we're really aiming for here is comparable health outcomes for English speakers and French speakers.